Joining us now on the line, Dr. Kellie Leitch, the Chief of Pediatrics at Batson's Hospital, also works with the Ole Miss School of Business. Dr. Leitch, thanks for coming on Middays.
Thanks very much for having me, Gerard. I'm excited to chat with you.
Absolutely. So tell us about this healthcare innovation event you guys had this past Tuesday, right?
Yeah, it was a fabulous event. It was an opportunity to bring people together who have different perspectives. So individuals from the business community, people who are healthcare providers, whether that be nurses, docs, physiotherapists, and policymakers, to have a discussion about the best way forward for patient care.
Right. Well, I got to tell you, just my perspective, and then I'll be quiet and let you react. I have felt for some time that, of course, healthcare and the healthcare economy, what's described with the acronym HCA, as you well know, represents 16% of the total GDP in this country, about $3.4 trillion. I've always felt that when we hear the average American talk about, wow, the rising cost of care, premiums go up on insurance, out-of-pocket costs as well. Just in general, they're astonished when they get these bills from patient care, from healthcare services. And something that's I've always thought has occurred to me, Dr. Leitch, is that the good news is we keep inventing more care. We come up with more treatments, more drugs, more procedures, new novel approaches to cure disease and to just improve health outcomes. The downside of that is we all want it and it costs money. And I've always felt that the approach and the proper and most effective way to develop and introduce these new approaches with respect to consumption and delivery of care to do that on a cost-effective basis is through innovation. And that requires, I think, the group of people or representatives from the various groups that you had at this event.
Well, I agree with you. We need to be innovative and think of new approaches to diminish that enormous economic burden on people here in the state of Mississippi and on Americans overall, because the cost of health care continues to escalate.
Yeah.
And, one of the things that, I always talk to my father before I participate in these kind of events. I asked him his perspective, and he said, we need to prepare now for the future because these costs are getting so out of control. We need to figure out processes to dial them back.
Yeah.
And this conference I view as a win-win. It provides entrepreneurial opportunities in healthcare and in health to help transform the state's economy, hopefully create some new jobs and some new opportunities, but at the same time use those ideas, whether they be in a process or technology, to improve patient care and hopefully decrease the cost of it, make it more efficient. So you and I are on the same page on that one.
Yeah, I think, and the reason I point that out, Dr. Leitch, is because I think typically the default jump is always to insurance companies and the carriers. Mm-hmm. And I'm not defending them or I'm not a spokesperson for them, but I've always felt like, well, yeah, that's a factor and that's an issue, but the bottom line is they're being compelled to change their coverage models to cover more care, and that's a good thing. We keep producing and inventing new cures, new pharmaceuticals, and just everything involved in delivery of health care. But that costs money, and so everybody wants that covered, and everybody wants access to that care, and rightfully so. And we want them to have access to it, but we got to come up with something that moves the needle, and I think that's got to come from innovation from the industry. That just also helps to rein in the costs.
Yeah, like one of our sessions at the innovation conference was the future of technology and healthcare delivery. Do we actually need physicians?
Right.
And it was a healthy debate. We had some engineers from Mississippi State there, and one of them was like, no, you don't need a doctor at all. We can figure this out with an app. But I think most people think that there's an opportunity for technology to play a substantive role, but at the same time there needs to be oversight.
Yeah.
And that's a bit of a to and fro. We need to both need to be involved. We need these advances, and your point's well taken about the insurance companies then having to figure out a way to have them financed.
Right.
But at the same time, I'm hopeful that these technologies will diminish the cost to patients.
Right.
Because they can apply some of them themselves, or it makes a healthcare experience more efficient.
Totally
One
agree.
of the other things we touched on at the Health Innovation Conference was health, as opposed to health care that you already are ill or sick and need care, maybe focusing on preventative health, making sure that Mississippians are well educated on how they can be healthier so they actually don't need to use the services at a hospital. And that may be also those may be valuable tools, valuable apps for people to have so they can take better care of themselves and their families.
It's a huge deal in our state, is it not, Dr. Leitch? I mean, I hear friends of mine, just anecdotally, who are physicians that talk about that regularly, that much of what they treat was totally preventable with just good personal practices.
Yeah, like the number one preventable item for a child, I'm a pediatric orthopedic surgeon, is a preventable injury. Making sure a child wears a helmet when they're riding their bike, or making sure they have the right protective equipment when they participate in a sport.
Yeah.
When it comes to adults, and even some children in the state of Mississippi, obesity is a real issue, and that drives diabetes and coronary artery disease. These are things that just simple nutrition and a healthy lifestyle of exercising 3 times a week can make a big difference.
Yeah.
And, we see all the time these new wearables coming out that are pushing people to almost using gamifying to push people to create the right behaviors. Well, again, that was something we spoke about at the conference, sort of that design thinking to transform consumer patient experiences, but also design thinking to transform how patients behave and encouraging people to be engaged in a healthy lifestyle as opposed to having to participate in health care.
Yeah. And private organizations, private companies can kind of move that needle as well. I know in my company, we had some apps we used where we would divide into teams, and we had people all over the country. We divide into teams, and the apps would track your movements and your steps and so forth, and we would give awards to the team who scored the highest on the app, and it was all about just trying to exercise.
Yeah, exactly. Like, competition is a healthy thing when it's getting people up and motivated. And I think a number of the people that presented at our conference, we had a good fortune of having some outstanding speakers. Dr. LaDonna Nothington, who's a nurse educator, and Dr. Richard Sumners, who is moving on to a health innovation initiative for the state of Mississippi.
Yep.
These folks had great ideas, and I'm hopeful going forward we'll be able to get a broader breadth of people from the community to participate in what I hope will be an annual conference.
What's the connection to the Ole Miss B School? I'm an alumnus.
Well, this was actually a symposium, an initiative of the Ole Miss Business School.
Okay.
I have the good fortune of working at the Children's Hospital, but I'm also a cross-appointed professor to the business school.
Okay.
And so this was an initiative that myself and my colleague, the Associate Dean Paul Johnson, had thought of, and we thought bringing together people with different perspectives to find better solutions for patient care would be a great idea. We have a new series of courses in health at the business school, and this will be the culmination annually now for our students. We have 40 students participating in a health business program, and we want to make sure our students have this opportunity to be involved in the Innovation Conference. And part of it was a hackathon, so put their ideas together and pitch their business so that they can have an opportunity in the future to maybe have some venture capital funding and move forward with a great idea.
I think it's a fantastic idea, and I think that just recognizing that there is intersection and there's overlap. There's the economic aspect of healthcare, and of course there's the clinical aspect of healthcare. And when we kind of operate in vacuums and really don't, I guess, have any sort of synergy going on there, I don't think we're reaching our maximum potential in trying to address these issues. Oh,
absolutely. And again, to go back to our conference, we were very fortunate. We had people who have been patients.
Yep.
A good friend of mine, Julie Kelly, came and shared her story, and then fabulous physicians like Dr. Scott Rogers, who's
awesome.
now he's in the mental health field, that was just outstanding in sort of outlining how we bring patients to the table, but also businesses, policymakers, others to the table to make sure we get to some good solutions.
I think it's a great idea.
It's a work in progress. We just started. We were about 100 people this time, and I'm hopeful next year we'll grow to be at least double, if not triple that size.
Keep going. I think it's a great idea. Thank you, Dr. Kellie Leitch. Thanks for coming on. You bet. Middays, we'll step aside for a break. We'll come right